Is organic produce really safer to eat? Debunking myths and revealing the truth. Primetime Health. Welcome to Primetime Health, where we bring you in-depth insights into wellness, nutrition, and healthy living. Our mission is to empower you with the knowledge to make informed choices about your health. From tackling food safety myths to exploring cutting-edge health tips, we've got you covered. If you're new here, don't forget to subscribe, hit the bell icon, and join our growing community of health enthusiasts. Organic produce often comes with a higher price tag and the perception of being healthier, safer, and more environmentally friendly. But is organic food really safer to eat? A recent recall of organic carrots due to a deadly E. coli outbreak has raised critical questions about the safety of organic produce. The incident resulted in 38 illnesses and one tragic death, reminding us that food safety concerns don't stop at the organic label. This leads us to some important questions. What does organic actually mean? Does the label guarantee better safety or nutrition? And how can you reduce your risk of foodborne illness? In today's episode, we're diving deep into the truth about organic produce, debunking myths, analyzing research, and giving you actionable tips to ensure your food is as safe as possible. Stick around because this is a conversation you won't want to miss. What does the organic label actually mean? To understand what makes food organic, let's start with the basics. The USDA organic label requires farmers and producers to meet strict standards. These include avoiding synthetic fertilizers, most synthetic pesticides, and genetically modified organisms, GMOs. Growing crops on land that's been free of prohibited substances for at least 3 years. Using natural pest control methods and fertilizers, such as composted manure. However, here's the catch. The organic label doesn't necessarily guarantee that the food is safer, cleaner, or even more nutritious than conventional options. Instead, it's about how the food is grown and processed. For example, organic farmers can still use pesticides, but these must come from an approved list of substances considered natural. Even then, some natural pesticides can have risks, and their application may not fully eliminate potential contaminants like bacteria or pathogens. Stephanie Taylor, a food safety expert, points out, the organic label focuses on crop management, not food safety. It doesn't mean the produce is free of harmful bacteria or cleaner than conventional varieties. Are organic foods safer to eat? Many people assume that organic food is inherently safer, but research tells a different story. Pathogen risks exist across the board. Pathogens like E. coli, Salmonella, and Listeria don't discriminate between organic and conventional crops. Whether it's organic lettuce or conventional spinach, produce is grown outdoors, where exposure to animal waste, contaminated water, or unclean handling practices can occur. A 2012 review, published in the Annals of Internal Medicine, examined data on contamination levels in organic and conventional produce. It found no significant difference in the risk of E. coli contamination between the two. Organic practices can add risk. Some organic farming methods may unintentionally increase the likelihood of contamination. For instance, composted or raw manure. Organic farmers often use these natural fertilizers instead of synthetic ones. While regulated, improperly composted manure can carry pathogens like E. coli or Salmonella. Even after waiting the required 90-120 days for the pathogens to break down, some harmful bacteria can persist. Post-harvest practices. Unlike conventional farming, where chlorine is often added to wash water to kill bacteria, organic producers may avoid using chlorine. While this aligns with natural principles, it can allow cross-contamination during washing and packing. A 2019 study published in Missouri Medicine found that organic produce is recalled more often than conventional options, up to 8 times more frequently in some cases. Does organic food reduce exposure to chemicals? One of the most common reasons people choose organic is to avoid synthetic pesticide residues. But are those concerns warranted? The truth is that both organic and conventional produce have very low levels of pesticide residues, well below the limits considered safe by the Environmental Protection Agency, EPA. A 2021 analysis of over 10,000 food samples found that more than 99% of both organic and conventional produce met safety standards for pesticide residues. While organic produce generally has fewer synthetic pesticide residues, it's important to note that organic farmers can still use natural pesticides. And natural doesn't always mean harmless. For example, copper sulfate, a natural fungicide used in organic farming, can accumulate in the soil and has its own environmental risks. Does eating organic lower long-term health risks? Some studies suggest potential links between organic food consumption and lower risks of chronic diseases like cancer. For instance, a 2018 study published in JAMA Internal Medicine suggested that people who ate organic foods might have a slightly lower risk of certain cancers. However, experts caution against overinterpreting these findings. The American Institute for Cancer Research, AICR, highlights that the study didn't account for other factors like overall lifestyle. People who eat organic food are often more health-conscious, exercise regularly, and avoid smoking, factors that play a more significant role in cancer prevention than simply choosing organic over conventional. Nutritional comparison: organic versus conventional. When it comes to nutrition, research hasn't found substantial differences between organic and conventional produce. A landmark 2012 review analyzed over 200 studies comparing nutrient levels in organic and non-organic foods. It concluded that while there may be minor variations in some nutrients, they weren't significant enough to impact overall health. Keith Warrener, a food scientist, explains, "The idea that organic produce is inherently more nutritious is a misconception. Nutritional content is influenced more by factors like soil quality, crop variety, and freshness than by organic status." How to ensure your produce is safe to eat. Regardless of whether you choose organic or conventional produce, there are steps you can take to minimize the risk of foodborne illness. Stay updated on recalls. Pay attention to food safety alerts, particularly for high-risk items like bagged salads, sprouted seeds, and frozen berries. These products are more prone to contamination due to processing and storage methods. Wash your produce thoroughly. Always rinse fruits and vegetables under running water before consuming, even those with inedible skins. Scrubbing melons or cucumbers can prevent bacteria from transferring when you cut into them. Handle food properly. Store perishable items in the refrigerator and avoid leaving produce at room temperature for extended periods. The USDA recommends keeping foods out of the danger zone between 43 degrees and 140 degrees, where bacteria multiply rapidly. Choose whole produce. When possible, pre-cut or bagged produce carries a higher risk of contamination than intact fruits and vegetables. The organic label offers reassurance about farming practices, but it doesn't guarantee safety or superior nutrition. Both organic and conventional foods can harbor risks if not handled properly. The key takeaway? Focus on eating a variety of fresh, plant-based foods, regardless of their label, and follow food safety best practices to protect yourself and your family. Thank you for watching Primetime Health. If you found this deep dive helpful, don't forget to like, share, and subscribe for more in-depth health insights. Until next time, stay informed and stay healthy.